We began the summit this morning hearing from Baltimore's new health commissioner, Dr. Taylor, and she talked about getting data in the hands of the community and the power that can have. What you've been doing within NRDC is helping communities gather and collect data and own it themselves.
Sure.
We don't have a lot of time. I want you to talk really briefly about what that means, like data to the people, and then talk about two communities that are acting to make their communities more environmentally sound. One in progress and one a success story, because I think everybody here needs a success story.
Yeah, so I mean, one of the things I first learned when I started coming up doing this work in Houston, we're going to talk about Houston in a minute, is that there really isn't a whole lot of data about actual environmental conditions on the ground, especially when you were talking about the communities that have the greatest environmental risks, the greatest pollution challenges, communities that have been most marginalized over time. We really don't actually understand what is happening in those communities. Luckily, with the increase in technology, the affordability of sensors, the reliability of the sort of data that comes out of those sensors, we have a real opportunity at a time when our democracy is being attacked on an hourly basis to democratize environmental health protection by taking advantage of these low-cost sensors and the interest across the board from community advocates, from public health researchers at academic institutions, from state and local governments, to actually start putting those sorts of environmental monitors and sensors out on the ground across communities, and really from the ground up have communities generating the data, owning the data, and then using the data with their partners, with organizations like the Natural Resources Defense Council, to really make informed decisions about the places with the greatest pollution risks and the sort of interventions that are most effective at improving health conditions in those communities.
So what's going on in Houston? A hugely polluted petrochemical,
Right. You told me you were reading about Houston last night and you were a little scared.
I've read about it before, but I reviewed it, yeah.
I mean, that was one of the things in Houston, like going back, again, to when I was first starting out as an environmental health and justice advocate there, just realizing that we had these huge pollution challenges all over the Houston region. And even though Houston would regularly tout itself as one of the most monitored parts of the United States, you really didn't know that much. And especially, again, in those communities that were right up against the refineries, right up against the ports, right up against metal shredders or concrete crushers, you didn't know what the health impacts were in those communities. So we started using community monitoring decades ago in the Houston area. Everything from getting a new ozone monitor put in the place that the models showed actually had some of the worst ozone in the entire region, didn't have an ozone monitor there, so we actually forced the state to work with the county to put an ozone monitor in there using our own low-cost sensors to kind of prove that the models were right, all the way up to using information we got about toxic chemicals around refineries when we would comment into, federal rulemaking processes, down to, what Air Alliance Houston, my former organization that's still down there kicking butt, is doing today, is using those sorts of low-cost monitors and sensors to really characterize the threats from things like a mobile batch concrete crushing facility that will go from community to community, to really get local city council members and mayors to understand with their public health departments just how big of a threat those small sources of pollution are for people that live right around them.
These are mostly poor minority communities.
Tend to be communities of color, working class communities, lower income communities that don't otherwise have a voice, or even when they use their voice, aren't listened to. And when they can show up in a city hall or in a state capitol or just at the public health department saying, no, my baby's sick, I feel horrible, I smell it all the time, I can see it when I wake up in the morning and I take the film off my car, and here's a report from a monitor that we put up, that can really help be that straw that breaks the camel's back in terms of actually getting public health officials or elected officials to take them seriously, to hear and understand, because now you have a piece of scientific data that the community trusts because they made it themselves, and they are confronting experts who lack that data with information that is filling in the picture for them.
Okay, we don't have a lot of time. Just 3 sentences on the big win in Buffalo.
Sure. So another one of the big wins in my experience when I was at EPA running the environmental justice program was a really great environmental justice organization up in Western New York, Push Buffalo. They had many communities that were regularly being impacted by really dirty, really harmful pollution from a coking facility. If you don't know what a coking facility is, one of the most dangerous forms of pollution out there. So they started putting up their own monitors around this coking facility, and after years of effort and years of fighting for it, they convinced both the state of New York to work with the Environmental Protection Agency to really get that coking facility and their emissions in hand, and led to the closure of that facility that never should have been located in a place like the community of Tonawanda right outside of Buffalo.
Unfortunately, that's all the time we have, but he's ending on a win.